In a world still recovering from the shocks of recent pandemics, a new global health crisis has emerged, demanding immediate attention. On August 14, 2024, the World Health Organization, WHO, declared the resurgence of Mpox, commonly known as monkeypox, as a public health emergency of international concern, PHEIC. This announcement marks the highest level of alarm under the international health regulations and underscores the severity of the current situation. Mpox, a viral zoonotic disease, has been known to the world since the 1970s. However, it wasn't until 2022 that the virus began spreading rapidly outside its traditional endemic regions in Central and West Africa. Now, in 2024, the situation has escalated to a critical point, with new outbreaks in the Democratic Republic of the Congo and neighboring countries, prompting the WHO to take decisive action. Mpox is caused by the monkeypox virus, a member of the orthopox virus genus, which also includes the smallpox virus. Although Mpox is less severe than smallpox, it can still cause significant illness, with symptoms including fever, headache, muscle aches, swollen lymph nodes, and a distinctive rash that progresses from macules to vesicles, pustules, and scabs. While the disease is typically self-limiting, severe cases can occur, especially in children, pregnant women, and immunocompromised individuals. Historically, Mpox was primarily confined to Central and West Africa, where it was transmitted to humans through contact with infected animals, particularly rodents. Human-to-human transmission was considered rare, typically occurring through close physical contact or respiratory droplets. However, the situation began to change dramatically in 2022 when cases were reported in non-endemic regions around the world, signaling a shift in the virus's behavior. The multi-country outbreak that began in 2022 was a wake-up call for global health authorities. Thousands of cases were reported across Europe, North America, and beyond, leading to widespread vaccination campaigns and public health measures. Despite these efforts, the virus persisted, with sporadic outbreaks continuing through 2023. By September 2023, a new clade of the monkeypox virus, known as clade IB, began to emerge in the Democratic Republic of the Congo. This clade, which has now spread to neighboring countries, has proven to be particularly concerning due to its rapid transmission and evolving patterns of spread. As of August 2024, the situation has reached a critical point. The Democratic Republic of the Congo is experiencing a significant upsurge in Mpox cases, with the clade IB virus spreading rapidly among adults through close physical contact, including sexual contact identified within networks of sex workers and their clients. This mode of transmission has led to a sharp increase in cases, particularly in eastern parts of the country. The virus has not stayed confined within the borders of the Democratic Republic of the Congo. Neighboring countries, including Burundi, Kenya, Rwanda, and Uganda, have each reported their first cases of Mpox, with all identified cases linked to the clade IB strain. Epidemiological data suggest that this clade is spreading quickly among affected populations, and there are growing concerns about its ability to establish a foothold in these regions. The situation is further complicated by the spread of a different clade of the virus, clade 2, which has been reported for the first time in Côte d'Ivoire since the start of the multi-country outbreak in 2022. This clade, while genetically distinct from clade IB, poses its own set of challenges, particularly as it begins to spread in new environments. The WHO's decision to declare the Mpox outbreak a PHEIC reflects the seriousness of the current situation. This designation is reserved for extraordinary events that pose a public health risk through the international spread of disease and that require a coordinated global response. The last time the WHO declared a PHEIC was during the COVID-19 pandemic, underscoring the gravity of the Mpox outbreak. The resurgence of Mpox in 2024 has had a profound impact on the affected countries and populations. In the Democratic Republic of the Congo, The health system is under immense strain as it grapples with the rising number of cases. The virus has not only spread within urban centers, but has also taken hold in more remote areas, complicating containment efforts. The neighboring countries of Burundi, Kenya, Rwanda, and Uganda are now facing their own challenges as they work to control the spread of the virus. In these countries, the identification of clade Ibe has raised alarms about the potential for the virus to establish itself in new regions, leading to ongoing transmission and periodic outbreaks. In addition to the immediate health impacts, the Mpox outbreak is having broader social and economic effects. The stigmatization of affected individuals, particularly those associated with the initial networks of transmission, has led to discrimination and social isolation. This, in turn, has made it more difficult for public health authorities to reach those most at risk and to implement effective control measures. As the virus spreads further, the affected groups are changing. While the initial outbreaks were concentrated among specific networks, Mpox is now taking hold within households and other settings, affecting a wider range of individuals, including children and the elderly. This shift in the affected populations is a concerning development, as it increases the potential for the virus to spread more widely and to cause more severe disease. In response to the WHO's declaration of a PHEIC, countries around the world are mobilizing to address the Mpox outbreak. Vaccination campaigns are being intensified, particularly in high-risk areas, and efforts are being made to increase the availability of vaccines and treatments. Public health authorities are also ramping up surveillance and contact tracing to identify and contain new cases as quickly as possible. The international community is also stepping up its efforts to support the affected countries. Financial and technical assistance is being provided to help strengthen health systems and to ensure that the necessary resources are in place to combat the outbreak. This includes providing support for laboratory testing, case management, and community engagement activities. Despite these efforts, the situation remains fluid and unpredictable. The virus continues to evolve, and there are concerns that it could mutate further, potentially leading to more transmissible or more virulent strains. Researchers are closely monitoring the situation and are working to develop new vaccines and treatments that can effectively combat the virus. The Mpox outbreak of 2024 is a stark reminder of the ever-present threat posed by emerging infectious diseases. The world is once again faced with a public health emergency that demands a coordinated global response. The lessons learned from previous pandemics, particularly COVID-19, have underscored the importance of preparedness, rapid response, and international cooperation in addressing such crises. As we move forward, it is crucial that we remain vigilant and proactive in our efforts to combat Mpox. This includes continuing to support vaccination efforts, strengthening health systems, and promoting public awareness about the risks of the virus and the steps that can be taken to prevent its spread. By working together, we can overcome this challenge and protect the health and well-being of people around the world. Thank you for watching, and please remember to stay informed, stay safe, and support efforts to end this outbreak.